Our pets are more than just animals. They are family members. They are confidants. They are sources of unconditional love. They weave themselves into the very fabric of our daily lives, greeting us with wagging tails and comforting purrs. Because they give us so much, it is our greatest responsibility to give them the best care we possibly can. This care goes far beyond providing food and shelter. It means actively participating in their well-being, learning their unique language of health, being their staunchest advocate. A healthy pet is a happy pet. A happy pet fills our lives with immeasurable joy. Taking proactive steps for their health is the ultimate expression of love. Understanding your pet's health is like learning a new language. It's spoken not with words, but with subtle signs and behaviors. Consistency is king in the world of pet care. Animals are creatures of habit, and they thrive on predictability. This routine starts with feeding. Try to feed your pet at the same times each day. This helps regulate their digestion and can make house training a much smoother process. Using a high-quality food appropriate for their age, appropriate for their breed, appropriate for their activity level. Don't guess what's best. Ask your veterinarian for a specific recommendation. Exercise is another non-negotiable part of the daily dance. Daily physical activity is crucial for maintaining a healthy weight, which protects their joints and vital organs. Mental stimulation is just as important as physical exercise. A bored pet is often a destructive pet. You can practice simple training commands or teach them new tricks. Finally, don't forget the importance of clean water. Fresh, clean water should be available at all times, and regular potty breaks are essential. This daily dance of care is a simple rhythm that leads to a long, harmonious life together. Grooming is so much more than keeping your pet looking good. It's a critical part of their overall health. It's an excellent opportunity to bond with them. Regular brushing does more than remove loose fur. It prevents matting. It distributes natural oils throughout their coat. That keeps skin healthy and fur shiny. It also lets you do a mini physical exam at home. Feel for any unusual lumps, bumps. Check for ticks hiding under the fur. Look for skin irritations, rashes, dry patches that might signal an allergy. Nail care is often overlooked but vital. Long nails can force toes into an unnatural position and make walking painful. Over time, that can lead to joint pain and arthritis. Learn to trim nails with the right tools, or have a groomer or vet technician do it regularly. Dental hygiene is another pillar of preventative health. By age 3, most pets show evidence of periodontal disease. Brush your pet's teeth several times a week with pet-safe toothpaste. Check ears weekly for trouble. Healthy ears, clean, pale pink, no odor. Eyes should be clear and bright. A little sleep in the corners is normal. This regular grooming routine makes you the best monitor of your pet's health. Being prepared for a minor pet emergency can make a scary situation much more manageable. You don't need to be a medical expert, but knowing a few first aid basics can provide immediate comfort. Know how to stay calm. Pets pick up on anxiety. Speak in a calm, soothing voice and handle your pet gently. Your calm demeanor is the first step. Bee sting, wasp sting. Stings cause pain, swelling, and can cause an allergic reaction. If you see a stinger, scrape it out with a credit card or your fingernail. Avoid tweezers. Apply a cold compress for about 10 minutes. A baking soda and water paste can help. Handle minor bleeding by applying direct pressure. Use a clean cloth or gauze. Hold it firmly for several minutes so the blood can clot. After bleeding stops, clean gently with a pet-safe antiseptic wipe. Poisoning is a pet owner's worst nightmare. Chocolate, certain plants, household chemicals. If you suspect ingestion of any of these, call your veterinarian or a pet poison control hotline immediately. Do not try to induce vomiting unless instructed by a professional. Have the product's packaging handy so you can tell the expert exactly what your pet consumed. Even the most well-cared-for pets can get minor cuts and scrapes from time to time. When you discover a minor cut, the first thing to do is to carefully inspect it. A rough play session at the park, a snag on a thorny bush in the backyard, a sharp edge on a piece of furniture. Check how deep it is. Look for debris, dirt, glass, splinters. If the cut is shallow and less than an inch long, it's likely manageable at home. If the wound is deep, gaping, or bleeding profusely, see your veterinarian. Once it's minor, the next step is cleaning. Use lukewarm water to gently rinse. saline solution is a gentle flush, or a mild diluted antiseptic like chlorhexidine recommended by your vet. Avoid hydrogen peroxide, avoid rubbing alcohol, these damage tissue. Pat dry with a clean cloth or gauze. Apply a thin layer of pet-safe antibiotic ointment. Use a product made for animals or vet-approved. Optionally cover with a light bandage to keep it clean. Many pets chew bandages. Consider an Elizabethan collar. Monitor the healing process. Check the wound at least twice a day. Watch for signs of infection. Increased redness, swelling, bad odor, colored discharge. A minor clean cut should look better each day. Almost every pet will experience an upset stomach. It can be caused by something as simple as eating something they shouldn't have, a sudden change in diet, or even stress. The most common signs are vomiting and diarrhea. When this happens, it's natural to feel worried, but mild cases can often be managed at home. The first step is to give their digestive system a rest. Withhold food for about 12 to 24 hours. This brief fast lets stomach and intestinal inflammation calm. Keep providing fresh water while fasting. Vomiting and diarrhea can cause rapid dehydration. If not drinking, offer ice chips to lick or a small amount of low-sodium chicken or beef broth. After fasting, if vomiting has stopped, begin reintroducing food. Offer a small amount of a bland diet. Dogs, boiled unseasoned chicken, lean ground beef, plain white rice. Cats, boiled chicken. Start with a tablespoon or two to test tolerance. If kept down, offer another small meal a few hours later. Gradually mix regular food into bland diet over several days. If diarrhea or vomiting returns, or they seem lethargic or refuse to eat, stop home care and call your vet. Our pets can't tell us in words when they are feeling sick or in pain. Instead, they communicate through subtle changes in their behavior, routine, and body language. Learning to recognize these quiet signals is one of the most important skills a pet owner can have. One of the most significant signs is a change in appetite or thirst. If your normally food-motivated dog suddenly turns up his nose at dinner, or your cat starts drinking bowl after bowl of water, it's a red flag that something is wrong. Changes in energy levels and social behavior are also key indicators. A pet that is usually playful and energetic but is now lethargic, hiding, or sleeping much more than usual is likely not feeling well. Conversely, a pet that is suddenly restless, anxious, and can't seem to settle down might be in pain or distress. If a normally cuddly cat suddenly wants to be left alone, or a friendly dog growls when you try to pet them, they are sending a clear message that something is bothering them. Keep an eye on their bathroom habits. Straining to urinate, making frequent trips to the litter box with little result, or having accidents in the house are all urgent signs. Similarly, persistent diarrhea, constipation, or the presence of blood or mucus in their stool are all cause for concern. Finally, watch for physical signs of pain or discomfort. This can include limping, difficulty getting up or lying down, or a reluctance to jump or use the stairs. You might notice them repeatedly licking or chewing at a specific spot on their body. Changes in breathing, such as coughing, wheezing, or labored breaths, are always an emergency. When you notice any of these signs, trust your instincts. You know your pet better than anyone. Becoming a pet owner is like making a silent promise. It's a promise to love, protect, care for another living being for its entire life. This journey is one of the most rewarding experiences a person can have. The bond we share with our pets is pure and powerful, built on a foundation of mutual trust and affection. Fulfilling the promise of responsible pet ownership means more than just providing the basics of food, water, shelter. It means being their dedicated guardian, patient teacher, steadfast advocate in all matters of health and happiness. It's a big responsibility, but the returns are immeasurable. The knowledge you have gained about daily routines, grooming, first aid, and recognizing signs of illness is empowering. It transforms you from a passive owner into a proactive partner in your pet's health. This knowledge allows you to face minor challenges with confidence and gives you the wisdom to seek professional help when it's needed. Every time you brush their coat, check their ears, take them for an extra long walk, you are strengthening your bond and investing in their future. Remember to always be patient and compassionate, both with your pet and with yourself. There will be challenges along the way. There might be chewed up shoes, accidents on the carpet, unexpected vet bills. In the end, the greatest secret to pet care is simple: love. What a beautiful promise to make and to keep.